Hi everyone, my name is Tyler and my presentation is going to be about life with bipolar 1 disorder. And a little bit about me background wise, I was in the Air Force from 2012 to 2018, so I'm 27. And I was diagnosed in 2018 with bipolar disorder, which is what disqualified me from the Air Force. And man, let me tell you, that was a learning experience galore. So, I'm gonna get into it about the things that I've learned and some of the common misconceptions. For example, this is from my art store, but it says bipolar disorder. It's more than just a mood swing. So, let's get into it. Bipolar disorder is a mood disorder categorized by periods of extreme highs or extreme lows. So, contrary to popular belief, like I said, it's more than just a mood swing. So, when you're cycling, so not necessarily all year round, but when you're cycling, you can go like being from here, start your cycle to go here and then back down, or the opposite. Some people go down and then go up, or they have a constant pattern. There's also the possibility of having mixed episodes, so that is when you experience both ends of the spectrum at the same time. It's possible, and in individuals that experience that, it's rough. It can get rough. There are also different types of cycling. So there's some people that just cycle maybe once every few years because they're stable, once in a while. Then we have rapid cyclers who cycle maybe more than 3 to 4 times a year. And then you have people like me who are ultradian cyclers. So when we do cycle, so not only do I cycle multiple times a year, I also have rapid changes when I am cycling. So the best way I can explain it is I have a day and night change. So during the day, I'm more calm, upbeat, fun, and then when it gets dark, I'm moody, sad, irritated, and I don't want to do anything except lounge on the couch and be miserable. So that's the best way I can explain it. It's tough. Bipolar disorder is a spectrum disorder, so everyone that has this diagnosis will not respond the same to treatment or anything for that matter, and our symptoms may not be the same. For example, I can get spendy. I am one of those people that I have the symptom of reckless spending when I'm starting to go into hypomania and mania. However, others may be the type of people to drink excessively or work excessively. Back to the popular belief that bipolar disorder is solely just mood swings, it's pretty silly to compare the weather or your day to bipolar disorder if you're not experiencing all the symptoms, because with mania there's recklessness, there's feeling wired, there's being restless, agitated, and possibly irritated. Fun fact, I learned those are two separate words with two different meanings. There's also the possibility of binging on drugs and alcohol that goes into the category of reckless behaviors. There's grandiose thoughts that can come up where someone would really, they're more important than they actually are. Some may have delusions or hallucinations, and it can cause us to harm potentially, and also potentially cause others harm if we're not actively taking care of ourselves. Bipolar disorder is classified as a mood disorder, so that's exactly what it does. It affects your mood and it affects your behaviors. So, contrary to popular belief, it's more than just a mood swing. So, when you tell somebody you gone from happy to sad to angry to happy in a matter of 10 minutes. That's not necessarily the same as being bipolar. Because honestly, if you came up to me and said, "Oh, I'm having a bipolar day," I would ask you, "Oh, I wasn't aware that your day is having hallucinations and reckless behaviors and grandiose thoughts and hypersexuality and irritation, agitation." You see what I mean? That's the silly part that most people don't understand. My favorite source to get information on anything mental health is National Institute of Mental Health.gov. There's more than 2 types of bipolar disorder. So bipolar 1, the type that I have, we can experience depression, the stability, hypomania, which is below mania, so it's not as extreme, but it can get to a point where it starts to become more destructive than productive. And some people with bipolar disorder kind of like the hypomania phase because they feel like they can get more done, and it kind of stirs up the creativity, but that's also living on the dangerous edge. And then we can go into mania, which is the severe end of the spectrum. That if we are stuck in mania for a long time, some of us can go into psychosis. Others can end up in the hospital before their 7 days. That determines their mania period even hits. So yeah, they have classifications determine what's a hypomanic and manic episode, as well as depression. Bipolar 2, those individuals experience depression, the stability, and hypomania. They do not go on to the extreme end of mania. I know most individuals with bipolar disorder don't like it when our friends and family try to play doctor or nurse with us all the time and constantly asking us about our symptoms and how we feel. So just, it's good to know what to look for, but also not to hyper focus on it, if that makes sense. With that being said, some of the symptoms of the depression side, it's you get feelings of hopelessness, feelings of being slowed down or restless, unable to do like simple tasks. Some people don't like to get out of bed. Some people have the hardest time with basic hygiene. Some people just, they can do it all, except they don't have the motivation to do anything else other than that. And then the loss of enjoyment of the stuff they used to have fun doing. Appetite fluctuation, because it can go either up or down. Sleep issues, including trouble sleeping or sleeping too much, or having a hard time falling asleep. That's another one. Hypomania, so that's like slightly elevated than your baseline, but it's still, you can see that there's something obviously going on. So it's similar to mania, and the symptoms are less extreme, and hypomania cycles tend to be shorter. So usually they use the 4 to 7 day period classification for the various episodes. So if it's 7 days or longer, or you may have to be hospitalized for it, they're gonna classify it, or so on the mania side. And now symptoms of mania. So, as mentioned before, not experienced by individuals with bipolar 2 or cyclothymic disorder, with the exception of possibly being brought on by other substances. So, for example, caffeine. Too much caffeine can also mimic a manic episode, as well as antidepressants. The wrong antidepressant being prescribed to an individual with bipolar disorder can also send them straight into mania. That has happened to me before. So, some experiences, some symptoms of mania are feeling very elated or very irritable, feeling wired, so of course you're like bouncing off the walls, can't sit down, grandiose thoughts. Going to be honest with you here, one that I've been told, because I don't remember everything that goes on when I do go through full-blown mania, but I've been told that I like to think of myself as a superhero. and I can't die, and you can see how that is dangerous to myself in an episode and why I would need intervention. Less need for sleep is another symptom. Fluctuation of appetite, again, and feel as if one can accomplish many tasks at once, and I like to call that unproductive multitasking. And the risky behaviors such as heavy spending, gambling, drug usage, and hypersexuality, which means it's basically your sex drive is through the roof and you're willing to be risky about it. You don't care. Some people can't control it, even with treatment. And that's unfortunate. It does affect marriages. So here I included an image of bipolar disorder symptoms, the basic symptoms to be looking out for, but I want you to keep in mind that individuals that experience these symptoms may not always be individuals with bipolar disorder, because some of the symptoms can mimic borderline personality disorder, post-traumatic stress disorder, and attention hyperactive deficit disorder on that spectrum. For example, like the becoming easily distracted, that's something that's commonly known with ADHD, and the problems with memory and concentration is common with not only ADHD but PTSD. So triggers, let's talk about triggers, because that is a very important topic to know for yourself if you have this disorder, and your loved ones and family. So insufficient amounts of sleep. Sometimes for me, the first thing to go is sleep, and that's how I know an episode is coming. Altercations with loved ones, like having a fight with someone you really care about that's gonna affect you emotionally and stuff, that could really get you going and trigger some thoughts and turn into an episode. Alcohol and drug misuse. Caffeine is a drug, so I gave up caffeine after being diagnosed. It was a hard battle, but I gave up caffeine. And alcohol is also a depressant, so that's something I kind of gave up to. Certain antidepressants and other medications. I mentioned this before, that when some individuals prescribed an antidepressant for dealing with bipolar disorder, it can send them straight into mania. So it's known not to necessarily give someone with bipolar disorder only an antidepressant. They have to have antidepressants along with a mood stabilizer. Pregnancy and other hormonal conditions can be a trigger for bipolar disorder as well. And my presentation was a little bit all over the place because, like I said, I can't concentrate well, and I also have social anxiety. But that's pretty much life with bipolar disorder, and it affects everyone differently. Some make the sacrifices, some don't. Some things that do help include, at least for me, but some treatments that do tend to help others are psychotherapy, so going to therapy, medications, but at the same time, medications don't work for everyone, and the same medications don't work for everyone. I went through a let's say like one of those old-time scrolls. I went through one of those old-time scroll list of medications before we found the right fit for me. And I experienced side effects such as weight gain, additional pain. I had stiff neck at one time because of medications. It's really a battle. It's trial and error. It's a battle. Fitness helps. So if you are able to work out, just 30 minutes 3 times a week is beneficial for cognitive behavior. So that's something that I strive to do to help keep me chilling, because and I believe that's it. Thank you for listening to my cultural presentation, my culture of living with bipolar disorder.